also Black Friday week. That's right. It is Black Friday. It's always Black Friday around here at ReMar Review, but this week particularly is Black Friday week, which means we have so much in store for you. And it doesn't even matter if you are studying for T's, if you're studying for nursing school or NCLEX, we got it all. Tonight, though, is T's night, which I'm really excited about. So if you have been wanting to go to the T's review and you want to hear more about the entrance exam, that's what I'm doing tonight. So here are my classes for this week. Are you ready? And guess what? You're welcome to attend all classes at all levels. It doesn't even matter. So I am doing master classes tonight for ATITs and HESI. And I'm also doing a game night where I will be giving away $100 cash prize for students who are getting first place, second place, or third place in the Kahoot game for ATITs. So I think first place will be $100. Second place will be like $50. Third place will be $25. So come to that class. It's tonight at 8 p.m. is the master class, and then the game night is at 9 p.m. This is Monday motivation. Also, Tuesday, which is tomorrow, is our nursing school day. So we will be focusing on nursing school. I'm going to talk about mentality. I'm going to talk about traps in nursing school. Also, some things that you need to think about and prepare for nursing school. I'll also be doing a pharmacology review tomorrow. So pharmacology review tomorrow as well for nursing students. And then on Wednesday is NCLEX game night. We'll be doing NCLEX game night, which is going to be really fun. And then Thursday is Thanksgiving. So we have Thursday at Thanksgiving, and then we have Friday will be the Black Friday Masterclass. Let me know in the comments where you are watching me from. I see I got UK in the house, and I am really excited about this week. Screenshot this. Screenshot the times because the Black Friday Masterclass starts at 2 p.m. and then it will run to 4 p.m. with Elder Mark Callion, the president of ReMar Review, doing a devotional for that Friday. Okay. So a whole list of things for us to do. TikTok is saying I'm muted. I don't know how to unmute myself there. All right. Let's go on to the big thing this week is it is 50% off for the Black Friday sale. So that means the entire ReMar store. That is the opportunity that we are extending specifically for Black Friday. So I'm counting down the days. I think we have like 5 days left to Black Friday. So that is the opportunity. And what I like about this particular Black Friday sale is that we've included renewals in the Black Friday sale. So if you use the code BF50, then you are going to get 50% off of even renewals, off of all of the books and off of the trainings. I was looking for my first shift book because I'm really proud of the resource that first shift book is, and that's just how to dominate your first 2 years of nursing. There is also the question bank as well. Where's that first shift book at? Oh, I don't see it. Hold on, I see it. Let me grab the first shift book as my light went out too. Let me grab the first shift book. So now it's going to be nighttime in the studio. Okay. So this is the first shift book, and I think the light will come back on. Mark, if you can help me, that'd be so great. Okay, this is first shift. A lot of people don't know about first shift, but it is my guide on how to really transition from that new nurse to someone who is seasoned, someone who knows how to speak to the doctors. They know how to interpret their patient signs and symptoms. They know how to pick the shift that is best for them. So first shift is perfect for this. And a lot of you are not familiar with this book, but this is my mentorship book. I will say to the masterclass, thank you so much, Mark. I appreciate you always being there. The masterclass is going to start on Friday at 2 p.m. Eastern Standard Time. I'm having another issue, please. Here on TikTok, they say they can't hear me, and I'm not sure why. Let me know on TikTok if you can hear me now. They were saying no sign, even though it's picking up down here quite well. So maybe you can check. Okay. All right. So that's first shift. Any other questions before I start? I thought the master class was today. The ATIT's master class is today. That starts at 8 p.m. The nursing school master class is tomorrow. And then the NCLEX master class will be Friday. But we're going to do a game night on those times. Okay. Now, let's talk about our remediation for this week. This month has been entirely remediation. And so all of you who have been extended remediation for ReMar, what you have is the remediation 5 worksheets. How many of you have done remediation 5? You're in it. You are on either week 1 or week 2. You are on either week 1 or week 2. You have done remediation 5. You have done your learning assessments, and then you have also taken the time. I love that. You've also taken the time to begin your remediation workbook. You have done that. Okay. This is part of the difference. Oh, I love that. Week 4. Look at this, everyone. 4, week 3. That means you started right away. Okay. What I love, this is what the difference is for remediation. Okay. And we're going to talk about remediation in a little bit. We're going to get into our point for today, and I have a few questions for you as well. But this is the difference with remediation. You're not starting with just practice NCLEX questions. You're starting with yourself. So you should be knowing more about yourself and how you think at the end of remediation. So that is my challenge to you who are watching, to begin that process, because I'm so encouraged. I'm so encouraged by what I'm seeing here. I'm so encouraged. Week 2, week 3. This means that you are willing to take that additional step to make sure that you aren't guessing, to make sure that you are successful. That is so phenomenal. So what a great way to start Monday. For those who asked, this NCLEX remediation workbook is in the file vault of the V2. It is in the file vault of the V2. And if you're not sure how to go about using this workbook, we have done videos on it. Check out my YouTube channel and go back and watch those videos on this. We did an entire study session on that. Week 1, and we'll be reviewing for this week's masterclass. Perfect. All right. So our topic for today, for class today, remediation and confidence. Remediation and confidence. And my point about remediation and confidence, good morning, everyone, is that starting with Monday, which is today, it's the first day of the week. I mean, you know that, right? But the reason why we gather on Monday is because it really sets the tone for everything that follows you in terms of your studying. So if you're preparing for NCLEX, how you start Monday is going to determine how you feel on Wednesday, and then certainly how you feel going into the weekend. When you have a strong start on Monday, the rest of your week becomes easier. And that's even for me in my life. I have a lot of things that I'm responsible for. I'm the CEO of ReMar. I also have another company that I am the CEO for. And of course, I have a family. There are a lot of things that I must do. So on Mondays is where the day is won and also the week is won. So keep showing up to class on Monday. You're doing a great job with that. When we talk about remediation, though, the challenge of remediation is at the beginning of remediation, it doesn't feel good. How many of you right now can agree with that? When you're doing the remediation process and you're going through V2, at first you're confused. At first you are you're confused. You're messaging the team like, I don't know what I'm supposed to do. This doesn't feel right. It's difficult. It feels slow and sometimes confusing, sometimes frustrating. And I know I felt that with you in the beginning when I was trying to explain the remediation process. I felt your frustration. And what I want to say on Monday is that even though with remediation, you don't see the results right away, every day you keep doing it, it gets better. You get stronger. Your brain gets stronger. Okay. And I wanted to speak to that because I don't want you to feel that you're on the wrong track. You're on the right track. It's just difficult in the beginning. It's difficult. When I first started my staffing agency, Safe Nurse Now, it was difficult in the beginning, as you can imagine, because it was a new process. So I had to learn all the things that went into looking for a great job for nurses. I had to learn about the different policies, and you got to get insurance for nurses. Even if they're not working, you have to have workman's comp. So all of these things were very challenging for me with Safe Nurse Now. And I'll tell you, if I'm transparent, I wanted to give up so many times. Like, I don't want to do this. And if you felt like that, then I can understand you. If you felt like wanting to give up because something was very confusing, I get it. I get it. But what I want to encourage you today is that every day you keep moving forward, it's better. So Monday is the perfect day to reset your focus. So confusion right now is not failure. Confusion right now is not failure. It means your brain is waking up. It means your brain is trying to figure out, okay, why is this important and what do I need to do? Also, I want to say feeling stuck doesn't mean you're doing it wrong. It means you are breaking old habits and building new ones. And growth in general feels what? It feels uncomfortable at first, but it works. And I want to let you know that who you are today should be evolving into something greater for every big opportunity that you have. So don't feel like you have to stay in a comfort zone. Okay. All right. Don't feel like you have to stay in a comfort zone in order to grow. You won't grow in your comfort zone. You're only going to grow by doing hard things. Does everybody understand me? You're only going to grow in nursing by doing hard things. There's a hard conversation going on right now about nursing not being a professional degree anymore. Have you heard that? So, a master's in nursing no longer considered a professional degree, or that's what everybody is saying. And I haven't even dived into it because it reminded me so much of history when they were trying to replace licensed practical nurses. And hospitals said that they only wanted registered nurses. They only wanted registered nurses. They didn't want LPNs. And so the common thought was, we're going to phase out LPNs. We're not going to need them. And what did that turn out to be? A complete disaster, because we all know that when it comes to nursing skills, nobody does it better than LPNs. When it comes to hands-on nursing care, if you have an LPN that is strong on your unit, that can do IVs, that can do wounds, that can put down NG tubes, your unit will run flawlessly. Huge mistake that the field is still recovering from. And so what they're trying to do now, if nursing isn't considered a professional degree, then that means you won't have access to financial aid in order to pursue that career in nursing. Now, think about that. Think about that with a nursing shortage and you can't pay for nursing school. What is that going to do to the growth of the profession? Now, I'll say this. For all of you who are at the end of nursing, do you know how much more you will be needed? Okay. Do you know how much more you will be needed? Think about this. Think about this. All right. If you don't have new nurses coming in, the nurses that are there are really rare. Okay. I'll go into something else. I'll go into something else right now. Because this could be a whole nother show. Maybe we might have to do a prime time thing on that. Okay. Black Friday is tonight and the class is coming up. All right, here we go. All right. Now, we talk about getting ready for remediation. Many of you may have not started remediation, but with Black Friday this week, we're going to be giving you previews of what that can do in terms of changing your trajectory. Also, it's very important to know with Black Friday, down at the bottom here, there's a great opportunity because all of the training and courses are 50% off. All of the training and courses are 50% off. Now, your commitment should not depend on your feelings. When we talk about being ready for NCLEX, we talk about remediation. The feelings change, but your discipline stays. Also, discipline is what carries you to your victory. It's not going to be the feel good things that keep you enduring in time. All right. It's not going to be that. It's going to be you having the mind that this is the way I should be doing. Is it recommended to do remediation if never completed ReMar V2? It is. If you've been out of school longer than 6 months, if you've been out of school longer than 6 months, or you don't feel confident in your knowledge, you feel a little bit shaky, do remediation. It's not going to hurt you. Okay, it's not going to hurt you to do it. So the more you do something, the more you study, the easier the questions will become. The more you review, the more your confidence will grow. Okay. Also, the more consistent you are, the faster that fear that you have will disappear. So every day, remediation is going to give you clarity step by step. It's going to give you clarity step by step. I want it. How about 30 years remediation? I'm not afraid of that time frame. If you're not afraid of it, I think it's cool. Let's do it. Let's do it. Because like I said, at the end of the day, nursing is needed. The profession is actually shrinking, and we need as many nurses as we can to get into the field. There is a new distractor on the NCLEX that I talked about yesterday, but you might have missed that broadcast. Imperfect delegation. And whenever I see the NCLEX changing, I want to bring it to your attention. And so this term NCLEX delegation, imperfect delegation for NCLEX is very meaningful because imperfect delegation, read this with me, it describes a situation where the LPN or the RN's choice isn't ideal, but it doesn't endanger the client. Does that make sense when I say that? So imperfect delegation is, it's not necessarily wrong, but it's a good distractor. In other words, it's only wrong if it violates scope, causes harm, or ignores priority rules like ABCs, safety, risk reduction. Okay. So it's tolerated on NCLEX as a great distractor. Okay, I got all kind of questions in the in the comments. These are good though. You guys came here for advice. You came here for answers. So I want to make sure I give that to you. I have registered for 3 months V2 and will start my med surge in January. Is it okay, please? Are you talking about the nursing school course or the NCLEX course? If you're talking about nursing school, then you have time to get in there. I actually have a class of practical nurses starting my med surge in the V2. They're starting today, but their med surge 1 is only 6 weeks. So they're going to be able to go through it pretty quickly. You should be able to go through it too. Okay. So imperfect delegation means that On NCLEX, you have a great distractor. So an example of that would be the RN delegates vital signs to a UAP after the client is stable post transfusion. So I said, is that wrong? Not necessarily. The client is stable. So is it kind of lazy of the nurse? Because should she go in there and do her own vital signs? Yeah, probably. But since the patient is stable, the RN is able to do that. We have to think about the term delegation. What does delegation mean? What does delegation mean if someone asks you to explain delegation? Because they always come with two words, delegation and assignment. A UAP is an unlicensed assistive personnel person. So somebody that is not licensed to do nursing. They're a nurse's aide. So delegation is the idea that when you give somebody something, you still have responsibility for it. Assignment means you give it to the person and they take full responsibility for it. That's the difference between delegation and assignment. So in your household, if you have children, how many people have kids in here? How many people are parents? So I have an 11-year-old daughter and I have a 1-year-old daughter. I can tell my 11-year-old, go get your sister some water. And my 11-year-old can do it. I've seen her do it. I know she's capable. I delegate the task to her. However, whose responsibility is it that the 1-year-old gets water? It's always going to be my responsibility, even though I gave it to my daughter to do. And that's what happens in nursing. How many kids do you have? You have 3 kids. Yeah. So it's someone not taking my responsibility, it's someone taking my task away from me, just the task, but I still keep the responsibility. Okay. Parents, a lot of parents in here, a lot of parents. Okay. All right. So that's what we're talking about with delegation. Now, let's practice. I like this testimonial. It came in big. Come and see what the Lord has done through ReMar. I got joy overflow in my heart. Today, I proudly say I am a safe ReMar nurse. Quick Facts in V2 is the antidote to NCLEX. That sounds like it's like a virus, NCLEX. Officially an RN. That is amazing. Congratulations. Everybody congratulate that a wonderful testimony here. Joy. Joy is what we want to have. Ooh, we. Okay. All right. Congratulations. Congratulations. All right. Now let's practice. Can we practice some of this? I just explained the concept. I want to go into it. Give me 1 second here. You know what, in 2026, I'm not tolerating any kind of foolishness. So if you're in the comments and you start acting out, I gotta delete you. Because this is a place of positivity. And on Mondays, we strive for the highest level of thinking, behavior, and also, you know, we just do it this way. So let's practice some questions, shall we? Let's do some practice questions. All right. We are talking about imperfect delegation. Don't forget, we have class again tonight at 8 p.m. You don't want to miss it. We're going to be doing ATITs tonight. First question is this. The RN is planning task for a client receiving the first unit of packed red blood cells. Which delegation requires follow-up? Number 1. Is it the UAP obtaining vital signs 30 minutes after transfusion begins? 2. The LPN monitoring for shortness of breath during transfusion. 3. The UAP offering oral fluids during transfusion. Or 4. The UAP verifying client identity with the blood bag before hanging the unit? Which one is going to be requiring you to follow up as the nurse? Okay. Welcome to Black Friday week. I'm wearing the attire to set the mood. All week is Black Friday. And so not only do we have amazing classes, we also have our entire ReMar store. We're following the customs of a massive discount. The biggest one we've ever done all year is actually 50% off, but you got to use the code. Somebody needs to write this code down, BF50. And that's what happens when you go to the site. BF50 takes 50% off. So I'm looking forward to this sale, just changing some lives, people getting back on the right track. I see 4. 4 is absolutely the correct answer, the correct way to go. I'm moving on. Here's the next one. This one is tough. Here we go. A nurse is supervising 4 LPNs performing basic care on a neurological step down unit. Neural step down unit. Each LPN reports a change in condition but continues the task. Which LPN must the nurse stop immediately? Number 1, bathing a post-op client who now becomes unusually drowsy and keeps nodding off. 2, repositioning a stroke client who now has a gurgling quality to their voice. 3, toileting a diabetic client who now reports feeling a little shaky with warm, flushed skin. Or 4, providing oral care to a client with mild dementia who now asks repeated questions and seems confused. Oh, all of these patients are struggling. They all have a sudden change in their condition. But if you're the nurse, who needs to be stopped and intervened immediately? I said yesterday, this is one of the hardest questions I have written this year. In all of 2025, this is one of the hardest questions. And I got this question after doing the remediation course. So if you want more challenging questions like this, the remediation exercises are challenging, aren't they? Anybody here has taken the context mix-up exam? Isn't that test tough? To me, it's tough. Also, second guessing. That one's tough too. All right. Correct answer is going to be number 2. Number 2 is the correct answer. This one was so tricky. This one was so tricky because it's an airway issue, but it doesn't explicitly say airway. It says what? Gurgling quality to their voice. And gurgling is a term. Yeah, it's a term where the sound is wet. It sounds like fluid. But I would say if you are not a US based nurse, you may not have used gurgling, right? It's almost a cultural term. And that's why it's important to really study for NCLEX if you're a foreign educated nurse, because NCLEX is very much a cultural exam to the United States. Okay. All right. So number 2 was the right answer here. Yes. And that's what we're going for. We want the exams to be challenging in remediation because it breaks you out of the pattern of looking for escapes. Okay. It breaks you out of the pattern of trying to find hacks or strategies to get you through. You really need to double down on your content. You really need to double down. And being uncomfortable now will make you a better nurse. Being uncomfortable now will make you able to handle stressful situations because the hospital environment can be stressful. All right, number 3. Here's a remediation question here. Which UAP action requires intervention? Number 1, checks a temperature in 30 minutes. 2, reports a blood pressure of 100 over 60. 3, heats up a meal tray of a patient with COPD. Or 4, repeats a blood pressure to see if it's right. Which one? This might be the second hardest question. What do you think it is? There is going to be new question types for the NCLEX exam. Maybe I should say this. There's going to be new categories of questions for the NCLEX exam, meaning your priority will shift in how you are to look at these questions. Okay. Yep. And so I see it now, and I'm going to have to do some workshops on this. So the correct answer is going to be number 4. The correct answer is going to be number 4. Why is that? Some of you have it already. Somebody that picked number 4, what made you feel like, that's not right? Some of you went with number 2, and I don't know why you went with number 2, because number 2 is fine. There's nothing wrong with a UAP doing that. Okay? There's nothing wrong with a UAP doing that. So if you weren't sure and you just went with number 2, then we got to break you out of second guessing, because you know that there's nothing wrong with that. Okay. Right. So let me read this to you. Why is number 4 unsafe? And we're about to get into the ReMar Thanksgiving devotional thought as well. So I got to really move. UAPs may collect information. UAPs may report information, but they cannot interpret or question or validate abnormal results. Okay. So the UAP deciding for himself or herself, like, let me do this again to see if it's right, that goes into something different from data collection. That goes in from data collection to interpretation, right? Yeah, yep. So if the blood pressure doesn't seem right, who should actually be doing that blood pressure? Okay, it's the nurse, it's not the UAP. So again, here, what I'm trying to get you to do is shift your thinking apart from just memorizing and recognizing things. Because if you struggle with overthinking, you can recognize something, but then talk yourself out of it, right? And those are the types of things that make you an unsafe nurse. Those are the types of things that make you an unsafe nurse. Does that make sense to you? Okay. So as you consider that, what does that mean even more of you? What does that mean to some of you who need to do that process and go through that process before testing again? And the reason why you come to class on Monday is so that you can evaluate in real time the struggles that you have. Because if it is the thing about second guessing or overthinking is that those are mentality changes. Those are not just getting answers right or wrong, but it's how you think. It's how you think. So we're going to work on that. Again, remediation is there for you. All of you who are doing it right now, that is the process that you're going through. I'm coming back on tonight at 8 p.m. for my ATITs review. Before I go, though, I do want to talk about our motivational thought for this week. And honestly, everyone, it is just a reminder that listen to me, you are not in a physical battle. You are also in a spiritual battle. When you are making goals, when you are trying to get back on track, this is something that will be deterred from you to do in the physical, right? Maybe people discouraging you, maybe, you have trauma, you have anxiety, you have things that you have to overcome in the physical, but also in the spiritual. And so, how much more, if you recognize that, do you need assistance? Because you're able, when your car breaks down, you're able to go to the mechanic and ask for assistance, right? You have no problem doing that. It's not a second thought. You hear those brakes squeaking, you feel like your brakes are going to go out and you're not going to be able to stop. You take yourself to the mechanic, right? That tooth starts hurting and you think you got a cavity and you don't want a root canal. You take yourself to the dentist and say, I need you to fix this, right? We have no issues doing that in the physical world. But for some reason, we deny the spiritual component to our lives and we neglect that thing. And so we know that we're struggling in different areas. We know that we've been battling different spiritual attacks, like, whether it's, gluttony, eating too much, whether it's a spirit of depression or anxiety or lying or adultery or, any of the, the things that people struggle with secretly, but we don't take it to the one who can fix it. So my scripture from you comes from something that my husband and I we were studying, and it is essentially Jude 1:24 and 25. Somebody put that in the comments, please. I didn't get a chance to do a slide on it, but as we are going into the Thanksgiving holiday, man, am I thankful for Jude 1:24 and 25. Okay. And I'm going to say it, and it is this. The scripture says in Jude 1:24 and 25, now unto him that is able to keep you from falling and to present you faultless before the presence of his glory with exceeding joy. I'm so grateful that the word of God says that Christ's Spirit, Jesus Christ, is able to keep us from falling. And not only that, but he has a plan. The reason why he wants to keep you from falling is so that in his Father's kingdom, he can present you as a bride. He can present you faultless with exceeding joy in your life and the things that you have overcome. Isn't that amazing? Now who is able to keep you from falling. And so this week, I want you to have that reminder as you go about and you encounter different struggles, whether, like I said, whether it's financial, whether it's, just family life. We talked about being a parent. How many people know rearing a child in today's age is a challenge? And it is like, we're just trying to raise these children. We're trying to feed them, keep them healthy, but it is a struggle and it is a battle. And so we even have to say that prayer for our children. Lord, these children are growing up knowing more than we knew. They're exposed to so much, and there's so much sin that abounds in the world. We have to pray that Christ keeps our children from falling. Because I think that, we as parents can see their future, and we can see if you don't turn around, it is not going to be good for you. Even from a little child, we can see characteristics in our children, right? Amen. Like, we got to work on that, right? King says, I have one child, but it feels like I have three kids. Exactly. Right. Our children are wiser, but they're also exposed to more wickedness. And so we have to recognize the spiritual battle in their lives, but we can't do that. We can't pray for our kids if we haven't had the discipline to pray for ourselves. So this week, I want us to remember that as we are striving for, perfection through Jesus Christ. And part of that is being faithful to understand the world you live in. You're foreigners in this world. This is not your home, right? You're on a journey. So let us be on that journey with the promise of his future coming and joy in our hearts. Thank you, everyone, for attending Monday Motivation. This is Black Friday week, and we have another session on tonight, 8 p.m. Eastern Standard Time. Will you join me? It is for the ATI Teas review, which will start at 8. And then we will be playing Kahoot for 9 p.m., 1 hour after, or until I finish it. I think I have a bit for ATI Teas that I'll be discussing. I'll be doing medical terminology, introduction to medical terminology for them on tonight. So come and have a great time with us for this holiday season. And as always, blessings. And I believe you can, you will, and you must be a great nurse. Be a great nurse. I'll see you later. Bye-bye.